And for more on the health care bill, we're joined now by the president-elect of the American Medical Association, Dr. Cecil Wilson. Dr. Wilson, welcome to Bloomberg News.
Well, thank you so much.
Dr. Wilson, talk to us about the AMA deciding to back this legislation. What was it for your organization that basically put you in a position to say you will support this?
The AMA has been concerned right from the start about health system reform that makes this system better for patients, for Americans, and for the physicians who take care of them. We believe the Senate bill, as it has now been amended, gets us a step closer to the goal line in making that happen. And let me just mention two major things. Millions of Americans who now do not have insurance and therefore are at risk of being sicker and dying sooner will have insurance coverage. And in addition, millions of Americans who now do have insurance, but who are fearful because they know that a pink slip, a job loss, a business closing, or a pre-existing condition could remove that insurance coverage from them. This bill goes a long way in making assurances on both of those points. We think it's an important step.
Dr. Wilson, why was the group initially opposed to the Medicare buy-in plan?
The AMA has had a position that in opposition to a Medicare buy-in, we do not believe that expanding that program, a program which Congress has not been able to fund adequately, was the way on health system reform. So we felt that that was an inappropriate way to go. We were delighted when that was removed from the Senate bill, as well as several other items. There was a tax on elective cosmetic surgery. There was a fee for physicians to participate in Medicare and Medicaid. There were cuts in payments to non-primary care physicians in order to provide payment increases to primary care physicians. Senator Reid removed those in his manager's amendment. We felt that that was a very positive step.
Dr. Wilson, though, are you satisfied, though, that this is going to help bring down health care costs, not just a cost for insurance companies, but costs as well for doctors, especially when the Senate version doesn't have the so-called public option?
Well, the challenge of bringing down cost, or at least bending the curve, and that is slowing the rise in cost, has a lot of factors associated with it. In this bill, as well as in the House bill, there are measures related to quality improvement, to continuity of care, to medical homes, to comparative effectiveness research, things that we believe will assure us that patients are getting the right care at the right time in the most effective way, and that will be helpful in bringing rational decisions to this process.
Dr. Wilson, Howard Dean, the former head of the Democratic National Committee and himself a medical physician, was on Meet the Press on Sunday, and he expressed a concern. He said that cost controls in this legislation need to apply to hospitals. Would you agree with that assessment?
We think the approach to bringing down the cost or controlling the cost, again, has multiple focus. I mentioned several of those related to quality improvement. There's a whole other big area that's increasing the cost of care in this country, and that is personal behaviors. So the cost of inactivity, of obesity, of alcohol abuse and cigarette smoking are major factors in increased costs. So we have a big problem dealing with that. Just to name one, we know that obesity-induced type 2 diabetes in this country now contributes $140 billion a year to the cost of health care. We've got to work on that as well as a variety of other things.
Dr. Wilson, is there any way to approach that legislatively? Is there anything in either the Senate or the House version that addresses preventative care and education adequately, in your view?
There absolutely are measures that address that, both preventive medicine and, as I mentioned, continuity of care. There are changes, particularly in the area of Medicare, that would encourage preventive care, immunizations, things of that sort that can make a difference. But there are also measures to investigate how we can best motivate people to change their behavior to make a difference in these other diseases.
But Dr. Wilson, picking up on what Julie said, how do you legislate behavior?
we don't legislate behavior. What we do is to do that by example, and that's an example that's set at all levels of society. The easy part of that is that we know that changing behavior will make a difference. The challenge for us all is to recognize that behavior does make a difference, and for us all to make a difference in how we do things.
Dr. Wilson, just very quickly now, about 30 seconds left. How concerned are you once the Senate and House versions come together that a good bill will be the result?
We believe we're headed toward a good bill. There are several areas that we believe need to be worked on. One is the Medicare physician payment formula that needs to be changed. We have assurances that that will go forward during after the new year. There's some other parts of the bill that we're concerned about: an independent payment commission, some issues related to the data release, to quality reporting that we will work on in the Joint Conference Committee.
Right.
We believe we need insurance reform. We believe we're headed in that direction.
Dr. Cecil Wilson, President-elect of the American Medical Association.